All right, today we're going to talk about one of the most extensive and technically demanding operations in all of modern medicine. We're talking about a procedure that is, essentially, a radical replumbing of the entire human digestive system.
So, just to give you an idea of the scale of what we're discussing, think about this for a second. What kind of surgery is so unbelievably complex, so full of risk, and demands so much skill and endurance that it's actually earned the nickname Mount Everest?
Well, that would be the Whipple procedure. Its formal name is a mouthful, a pancreaticoduodenectomy. In this operation, surgeons take out the head of the pancreas, a big chunk of the small intestine, the gallbladder, and part of the bile duct. It is an absolutely radical solution, but it's for a life-threatening problem.
Okay, so let's get right into it. You're probably thinking, why on earth would anyone need a surgery that's so extreme, so high stakes? Well, the answer lies in the incredible foe that it's designed to fight.
Most of the time, the Whipple is the go-to weapon against pancreatic cancer, specifically when it's located in the head of the pancreas. And make no mistake, this is a really, really aggressive cancer. For a lot of patients, this massive operation is their only real shot at a cure.
And the numbers, they really tell the whole story. Without surgery, the 5-year survival rate for pancreatic cancer is just dismal. We're talking less than 5%. But with a successful Whipple procedure, that rate can leap up to 25%. It's a huge battle for sure, but this surgery offers a real, tangible fighting chance.
Now this right here, this shows you exactly why this surgery is so incredibly challenging. You're looking at a major intersection in the body. The head of the pancreas and the small intestine, they literally share a blood supply with massive vessels like the superior mesenteric artery and the portal vein. This means the surgeon is working in this unbelievably crowded, critical space, trying to carefully separate these structures without causing a major bleed. It's like trying to fix the plumbing in the most important, jam-packed utility closet you can imagine.
So, how in the world does a surgical team actually scale this mountain? Let's break down the key steps of the Whipple procedure itself.
So you can think of the first part as a massive demolition job. Surgeons have to carefully detach and remove all the diseased organs. But then comes the really intricate part, the reconstruction. They have to meticulously reroute and reconnect what's left of the pancreas, the stomach, and the intestine. These little reconnections, they're called anastomoses, are super delicate and absolutely crucial for the patient's digestive system to ever work again.
And just look at this. This slide shows the transformation perfectly. On the left in panel A, that's the original setup. You see the pancreas, the gallbladder, the small intestine, all connected. Now look at the right in panel D. That's the result. The head of the pancreas, the gallbladder, the duodenum, they're all gone, and the remaining organs have been replumbed to create a whole new pathway for digestion. It's just a stunning feat of surgical engineering.
And a feat like this, it takes a long, long time. The surgery itself can last anywhere from 4 to 8 hours, and sometimes even longer than that. Think about the focus and the pure endurance that takes from the entire surgical team.
Now, an operation this complex isn't just about the what and how. It turns out the who and the where are just as critical. When it comes to the Whipple, experience is everything.
Just look at this data. It's pretty stark. At hospitals that do very few of these, like less than 2 a year, the in-hospital death rate can be as high as 12 to 16%. But you take that to a high-volume center, one that does more than 5 a year, and that rate plummets down to just 4%.
And to give you some perspective on what high volume really looks like, a major center like Stanford does around 80 of these procedures every single year. That kind of repetition, that familiarity, it builds a level of expertise that directly saves lives.
So here's the bottom line, and the research states it pretty plainly. Where a patient gets this surgery can quite literally be a life or death decision. The number of procedures a hospital does is a huge predictor of survival.
But conquering the surgery itself is really only half the battle. For the patient, the journey continues with the huge challenge of recovery, which, believe me, has its own set of mountains to climb.
One of the absolute biggest hurdles is pain. The data shows that something like 90% of patients have severe pain after a Whipple. And managing that pain isn't just about comfort, it's absolutely critical for a successful recovery.
So there are really two main ways to go about it. The traditional way is with intravenous or IV pain relief. But a major study found that using an epidural, kind of like the one used in childbirth, had some pretty dramatic benefits. Check this out. The studies showed patients with epidurals had way lower mortality and complication rates, which meant lower costs and a faster recovery overall.
But it's not as easy as just picking one and calling it a day. Managing this kind of pain is a constant, dynamic process. So how do doctors and nurses make those crucial, minute-by-minute decisions right there at the bedside?
Well, they follow a protocol that's basically a constant balancing act. Nurses are always assessing the patient's pain on a scale of 0 to 10. If it hits a 4 or higher, they might bump up the epidural. But at the same time, they're constantly watching vital signs like blood pressure. If those drop too low, they have to adjust fluid levels. It's this continuous loop of assess, adjust, repeat.
And that's really the whole game right there. The ultimate goal is to give the patient powerful, effective pain relief without messing up their overall stability. It is a delicate, high-stakes tightrope walk every single hour.
The Whipple procedure really is the Mount Everest of surgery, a massive challenge for the surgical team and an even bigger one for the patient. But it also represents a peak of hope against a truly devastating disease. And that leaves us with one final thought. After conquering this summit, what's the next one for these patients and for the future of medicine?